Welcome back to Be Kind Pediatrics. Are you pregnant and wondering what you should be eating or thinking about as part of your prenatal diet? Today, we're going to talk all about the maternal diet, and we're going to focus specifically on the role of DHA in the maternal diet and its effect on newborn, extending all the way up to childhood. For those of you who are new to the show, my name is Dr. Blair Rolnick. I'm a pediatrician and mom myself. And so let's take a dive right in.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Often when I'm talking to moms, so as part of my program here at Be Kind Pediatrics, I do a prenatal course one-on-one with moms. And part of that is talking to moms about their health and how that affects their newborn. And so that starts really prenatally with the prenatal diet. And one thing I always like to talk about with my prenatal mamas is the importance of nutrition on their overall health. So not just for their child, but for their overall well-being and mental health and physical health as well. Today, we're going to focus specifically on DHA and how that affects newborns, but as an overall message, I usually tell pregnant mommies, really just think about having a whole food diet that is well-balanced and minimally processed. So keep yourself hydrated, eat fresh foods, again, whole foods where you can, and make sure your diet is overall balanced, as opposed to really focusing on taking specific supplements. Where you can, it's always best for both children and mothers to get their micronutrient and macronutrient requirements from food themselves as opposed from supplements. One supplement I do focus on, however, is DHA. And the reason for that is we'll talk all about why and the role of DHA and why it's so important. But as a supplement specifically, we know that in the US and Canada, most moms are getting around 30 to 500 milligrams of DHA in their diet daily. And we really want to see them get at least 200 milligrams per day in their diet. So we know that this is a common nutritional deficiency in the diet of our prenatal mothers. And why is that? It's probably because sources of DHA are not particularly popular, and sometimes even we recommend that pregnant mommies stay away from them. So great sources of DHA tend to be cold water fish, or animal-based DHA tends to be cold water fish. And we often are recommending that pregnant moms stay away from those cold water fish like tuna and salmon appropriately because they have high levels of mercury contamination, which makes it a little bit more challenging to get this in our diets. And then plant-based sources of DHA, such as seaweed and algae, are not frequently found in the US and Canadian diet. So this is one supplement sometimes, or one area sometimes I recommend prenatal moms do consider buying a supplement in if that's not part of their regular diet. So let's talk about the role of DHA on a biochemical level, because I really think that helps moms and parents understand why DHA is such an important nutrient overall in our children's and our own diet. So DHA is really found in the membranes of our neuronal cells, particularly in the cerebral cortex, as well as in our retina and our eyes, and then the synapses of neurons. So the synapses are the area of neurons where they fire and send messages. And so having the appropriate cell membrane really helps promote appropriate and optimal cell signaling. Specifically, we think in the cerebral cortex and the retina. So probably, and again, most of this research is based off the animal models, but probably DHA's role is its largest impact and role is in the development of our cerebral cortex as well as our eyes. Based on what we knew about the biochemical makeup of our brain cells and neurons, this really led researchers to want to look at the role of fatty acids, long-chain fatty acids, specifically DHA, and its role in things like cognition, IQ, intelligence, problem solving, and vision, because we knew that there was a concentration of this fatty acid in the makeup of those neurons. Most DHA is transferred to the fetus in the third trimester. Studies have also shown us that fetuses are not particularly good at making DHA themselves from fatty acid building blocks. And so the placenta, and our bodies are very, very clever, the placenta actually preferentially binds DHA as opposed to other fatty acids and brings that to the fetus. And so again, most of this transfer or uptake of DHA for the fetus occurs in the third trimester, which is why, again, usually in that third trimester prenatal class, I like to mention to pregnant mamas, think about DHA a little bit in your diet, because this is the time when your fetus or your newborn is really getting the most of that DHA from you. DHA is also transferred to newborns through breast milk and is found in most formulas as well, because it's such an important component of breast milk for new infants. So you get the majority of it transferred in the third trimester as a fetus, but then children and infants continue to get DHA through their diet in those first years, either through formula or through breast milk. So DHA has already been shown to have a potential beneficial role in behaviors such as ADHD, and we talked about that in a previous episode, as well as sleep, which you can reference in one of our previous episodes on sleep and DHA for that information. But it also has been shown to be beneficial for problem solving, behaviors, and vision, as well as sleep and behavior regulation. So today, let's talk a little bit about specifically the role of prenatal DHA and its effect on some of these outcomes. So let's start with sleep, because we know sleep is so important to the developing brain for helping children learn, recover, for our immunity, as well as for our behavioral and emotional control. There is emerging research that suggests that DHA supplementation by pregnant mothers leads to better sleep outcomes in their newborns. Particularly, prenatal DHA supplementation has been shown to help with sleep organization, which improved sleep organization has been associated with, again, better or optimal neurocognitive outcomes, as well as social and emotional outcomes. So one recent randomized control study, which was double-blinded, looked at mothers at 24 weeks up to delivery. And they took half those mothers and they supplemented them with DHA for 5 days a week, from again, starting at 24 weeks up until the time that they delivered, and the other half received a placebo. And what they found was those mothers in the treatment group had better newborn sleep outcomes. So at days 1 and 2 in life of their newborns, they had less sleep arousal. So it seemed to be that supplementing DHA in mothers in that prenatal period affected sleep architecture organization from the very first day of life. Outside of the potential benefits to sleep organization and architecture, there also have been studies looking at prenatal DHA supplementation and its effects on behavior. So one study, it was a randomized control trial looking at, again, pregnant mothers taking DHA around 300 milligrams a day, starting at 24 weeks gestation up until delivery. They then looked at those mothers versus the placebo group of mothers who did not take any DHA, and found that the mothers who were in the treatment group, their infants at 9 months had better problem-solving skills than the infants who were in the placebo group, suggesting that there is, again, some type of role for prenatal DHA and maternal DHA in the diet and its role in their children's ability to solve problems as young infants. Another study, which was out of Europe, looked at DHA and EPA supplementation. So they had, this was again a randomized controlled trial. They had the treatment group taking 500 milligrams of DHA and 150 milligrams of EPA versus the placebo who received nothing. And then looked at the outcomes, the neurocognitive outcomes of their children at 5.5 years. Interestingly, as part of this study, they actually tested the cord blood. So they took the blood from the umbilical cord and measured the level of long-chain fatty acids in that cord blood as part of their study. And what they found was that children in the treatment group, so mothers who were supplemented with DHA and EPA had better neurologic development at 5.5 years, suggesting that maternal diet may potentially play a role in childhood development as far out as 5.5 years. So these are probably long-standing outcomes potentially for an intervention that happens prenatally. Interestingly, in this study, they found that incremental increases in the cord blood of DHA was positively correlated with increases in the neurodevelopment of the children. So there was a positive association of actually a quantifiable amount of DHA in the cord blood and those neurocognitive outcomes, which makes a stronger argument potentially for the role, the causation between DHA supplementation prenatally and neurocognitive outcomes postnatally. The last study I want to talk about today was, again, a randomized control trial, and it was looking at, again, maternal DHA supplementation. This started a little bit earlier at 22 weeks gestation through delivery, and they supplemented with a lot higher levels of DHA, around 1,400 milligrams per day. And they looked at the children's ability to stick to a routine at 1, 4, and 6 months. And what they found was those mothers who were in the treatment group, so those who were receiving, again, 1,440 milligrams of DHA starting at 44 weeks gestation, their children had an easier time sticking to a routine at 1, 4, and 6 months. And I found that interesting because, again, we know that children thrive off routines. So children who are more easily and better able to adapt to routines do tend to have better sleep outcomes. They sleep longer with less nocturnal awakenings, and they tend to handle changes in their day-to-day a little bit better and have better social and emotional outcomes or behavioral outcomes. So again, I think it was kind of interesting that this that DHA correlated with an ability to somehow cope with routine easier in those early childhood years, months really. And then I think an important thing to mention is what were the risks versus what are the benefits. So whenever I recommend supplementation to a patient, I always like to say, like, what are the risks of taking this and what are the potential benefits? So the potential benefits that we talked about are maybe improvements in the quality of sleep, maybe some improvements in neurocognitive outcomes as well as behavioral outcomes. And the side effects were none. There were no poor side effects or adverse events reported with DHA supplementation in this amount. And so it seems to be a very safe intervention with no real downside and then potentially some upside. And so I think it's something worth considering and talking about, especially with our pregnant mamas. I hope that you found today's episode helpful. If you have any questions or concerns, please leave comments below.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.